All right, this skill is assisting your client to take medication. Remember, this skill will be helping your client to take the medication, not actually administering medication. Medication administration is something that you need nurse delegation for. Medication assistance is something that you, as a home care aide, are approved to do. If you're not sure or need clarification about this, see someone from the training department and they can explain it in better detail. To start this, first, you want to make sure that your client's doing well, have a little communication with them.
Are you okay? All good? You doing okay?
Yep.
Perfect.
Next, go ahead and pick up the chart and begin taking a look at the medications that your partner is going to take. The chart will contain the 5 rights of medication administration, as seen there. The rights are the patient, the medication, the route, the dose, and the time. Each one of these 5 rights must be verified 3 times to complete the skill correctly. You will verify the chart to the client, then you'll verify the bottles of medication to the chart, and then finally you'll verify the bottle of medication to the client when you're ready to give it to them. So let's take a look at the first step, how to verify the chart information with the client who's sitting in front of you.
Okay. The first one is the patient. So, your name is Son Goku? No, of course. So, Bruce Campbell? Your name is Bruce Campbell?
Yes.
Okay. He's saying medication is Hypnosil. And the time, 8 p.m. See? It's not 8 p.m. It's a.m. So, this medicine is for tonight, not for now. Well, the next one say Leonardo DiCaprio. Are you Leonardo DiCaprio? No, of course not. So, the next one is Bruce Campbell. Are you Bruce Campbell? Yes. The medication is some breaths. The time the medication is, the time the medication is a.m. A.m. Yeah, it's a.m. And dose is 1 pill by mouth. Okay? Now,
once you've verified the information on the chart and ensure that the correct client is going to be picked out, you'll also know how many medications that you're going to need to give to the client. At this point, we've established that only one medication listed on the chart is going to be given to the client at this specific time, 8 a.m. So we verified that the client is Bruce Campbell. The medication is Zombrex. The time is 8 a.m., and the medication also says 8 a.m. The dose is 1 pill, and the route, or the way the medication is given, is going to be by mouth. Next, go ahead and get the medicine bottles ready and verify that you're selecting the correct one by comparing it to the chart for an exact match.
okay. We say your name is Bruce Campbell. Okay. We're looking for the Bruce Campbell. It's the Son Goku, so there's no this one.
As you find medicines that you do not need, you can put them back inside the container.
Bruce Campbell, I put over here. Leonardo DiCaprio, this is not for you. Another one, Bruce Campbell, I put over here. And also I have another one, Bruce Campbell, I'm going to put over here. So now, we're going to look for the name, the medication. So it's some breaths. Okay, we had Hypnosil, it's not for you. We had Stat Flash, it's not for you. So, and we had some breaths. This is the medicine.
There you go. So once you've verified that the medicine is the correct medication and you've checked it against the chart, that each of the details matches the chart exactly with no differences, you know you've selected the correct medication. Next, you're going to assist the client to take the medications. So you can put the chart down at this point. You no longer need it. And the first step is you're going to take the cap off of the medicine bottle. And read the medicine bottle out loud one more time to verify the third of the 5 rights verification.
Okay. Name, Bruce Campbell, medication, Sombrex, time, A.M., 1 pill by mouth.
Once you've verified the 5 rights one more time, tap a pill out of the medicine bottle into the cap for the client. If you take too many, simply place the medicine back in the container and try again. But do not handle the medicine with your hands themselves. Never touch the pill. Next, make sure that your client has a cup of water and cue them to hold their hand out so you can place the medication in their hand.
I think it's better you give me the other hand.
Once you've placed the medicine in the client's hand, cue them to take the pill and then offer them some water to drink.
Thank you, Laura.
When the client has drank their water, ask them if their pill has been swallowed okay, or something like that.
Is swallowed okay?
You don't have to actually inspect their mouth. Don't worry. Finally, cue them to finish their cup of water while you get your medicine supplies cleaned up and put away properly.
Okay. How you feel? Good? God. Oh yeah,
If the
it's a
correct
sleeping
medicine
one.
has been given properly, your client will be safe and happy and healthy. If you gave the wrong medication, your client will probably fall over dead.
Oops.
That concludes the skill. Make sure that your partner has their common care items. At this point, once the common care items have been placed, go ahead and remove your gloves correctly, and you'll wash your hands, and then you can move on to the next skill.
That's complete.
All right. This skill is taking care of your client's fingernails, or nail care for short. The first thing you want to do is make sure that your client is happy and safe and they're doing okay.
Are you happy? Mm-hmm. You doing okay?
Yeah.
Perfect.
Next, make sure you have all of your materials organized and ready to go. You should be wearing gloves for the skill. You want to have a white bowl that you will use later to soak your client's hand in and fill with warm water. You want to have your orange stick for use to clean their nails. You want to have the nail file to file their nails. You want the lotion. You'll use the lotion to make sure that at the end of the skill, their hand is nice and moisturized and feeling good. And you want a medium-sized hand towel. You'll use this hand towel for a number of things, and we'll demonstrate those now. So first, to finish getting your materials ready, let your client know that you need to leave the room for a moment to go get them some nice, comfortable water.
Okay, I need to leave the room. I'm going to bring you nice water for you, okay?
Go to the kitchen sink, and while at the kitchen sink, fill the bowl with warm water. Not hot, not cold, warm water. Bring the water back to the client and have them check it to make sure that it's a comfortable temperature for them.
Can you check for me? It's good for you? Okay.
Place the water on the table. Take the hand towel and fold it over so it's rolled up nice and thick, and have the client rest their arm on the towel while they soak their fingertips in the bowl. The client will soak their hand for 10 minutes, but you're not really going to soak it for 10 minutes on the state test. You simply say, 10 minutes is ready, or something like that. Take their hand out of the bowl, and you want to dry their wet, drippy hand off now. Take the towel and pat their hand dry. Never wipe, never scrub, pat dry. Also, make sure you dry between the fingers. That's a separate checkpoint. And when their hand has been thoroughly dry, fold the towel over and rest their hand on the towel so they have a comfortable place to be while you're working on their nails. Take the orange stick and begin cleaning under their nail with the sideways pointy or beveled edge. Do a light, gentle scrape under each nail, and after cleaning under each nail, wipe the orange stick on the towel to make sure it's clean before scraping the next nail. Be careful when doing this. If you poke or push too hard, you can hurt your client. This is a sharp object, so be careful and be gentle.
Sorry.
When you've finished, you can throw the orange stick away and take the nail file. With the nail file, you want to file each of your client's nails in a couple of brisk, short motions, filing away from their body. Notice that she's moving in one direction as she's filing. She is not filing back and forth or a sawing motion like she's trying to cut down a tree. She's filing in one brisk motion away from the client's body to make sure that there's minimal splitting of the nail. You always want to file with the growth of the nail, not against the growth of the nail. And when you've finished filing all 5 of your client's nails, or 4 if they broke a nail, or 3 if they play with fireworks, throw the the nail file away and offer the client some lotion.
Would you like some lotion?
Mm-hmm. Your client will accept. Put some lotion on your gloves. You don't need a lot, just a little bit, maybe a dime or nickel-sized amount. Rub it into your gloves to warm the lotion, and then put the lotion on your client's hand in a smooth motion. It is okay to lotion between the fingers. That's perfectly fine. And when the lotion has been rubbed completely into the client's skin and you can't see it anymore, you've completed the lotion portion of this skill. At this point now,
I don't see anymore.
You'll simply begin cleaning up your materials and wrapping up everything. Take your towel and throw it in the laundry hamper.
You can put there.
Take the white bowl and the lotion and put the lotion back wherever in the room you found it originally. Take the white bowl to the kitchen sink. While at the kitchen sink, you're going to empty the white bowl in the kitchen sink, rinse it out good with hot water, dry the white bowl, and then place the white bowl on the counter next to the sink. The proctor in the exam will later clean and disinfect all these items that you leave beside the kitchen sink, so don't concern yourself with that now. Once you come back in the room, make sure your client has all their common care items. Make sure the client is safe and happy and comfortable. Take off your gloves.
Something for you, read from first choice.
Throw them away.
Task complete.
Tell the proctor you wash your hands, and you can say task complete because you're done with this one.
I wash my hands and task complete.
All right, for this skill, we are going to show you how to feed your client. For this skill, you'll need a couple of different items. Make sure everything's all ready and arranged before you start. You want to get a clothing protector so that the client's clothes are clean and comfortable throughout the skill. You want to have a little napkin, so if you get them a little bit messy, you can wipe their mouth and keep them clean. You want to have a beverage or something for them to drink. Water is usually used in the test. And you want to have a spoon to feed them with. Plastic spoons, of course, are provided. And a paper plate to place the food item on. The food item for this purpose is chicken pot pie. But for the test, you're probably going to be using Jell-O or pudding or applesauce or something similar that's easier even to show how to eat. The first step is you want to put the clothing protector on the client. When you're putting the clothing protector on the client, you also want to take this time to tell them to sit up straight. Keep in mind, if you fail to tell the client to sit up straight, they'll remain slumped over for the skill, and you'll probably fail the skill because having the client leaned over while you're feeding them is a choking hazard, and that's a big safety violation. Your next step, once the client is comfortable and ready, of course, you're wearing gloves for the skill, right? We see Litza with her gloves on, so don't forget that. Go ahead and take the food item, and for the test, you will have a table that will be between the two of you. We're showing, for the purposes of the video, the food on the side, but for the test, you'll place the table between the two of you, so it's in the middle of you and your partner. This will be demonstrated more clearly during skills class. So you want to begin feeding your client and just keep it fun and calm and natural. Treat it as though you have a friend who you're just helping him eat some food and take a few drinks and keeping him clean throughout the process. Feed until the food is mostly done.
You know, done. Okay, this is so good food. Open your mouth. Oh, so good, girl. Oh, so good.
Take your time and let them swallow.
Take your time. That's good. Do you want a little drink? All good? Perfect, perfect. See, because you have some little here. Okay, good. Good girl. Oh, I love it. Nice old woman. Remember, it's until you're done, okay? You need to finish all your food. It's delicious. All good? Take your time, no problem. Good girl. Good. You want a little drink? Slow. Slow. Good? Very good. Do you want a little more? Oh, yeah, so good. Sorry. ¿Mi amor? Okay. Okay, you done. No more? No more? Oh, good girl. Cheat all.
Once you've fed your client a bit and you feel like they've eaten enough, you can ask them the question, are you done or would you like some more? If your client says,
Are you done or you want? No, you done? Okay.
If your client says they're done, you can stop feeding them and begin cleaning up the rest of the process. Make sure you do a final wipe of their mouth to make sure that they're clean at the end of the procedure. And you can dispose of the food items appropriately. Everything can be thrown away in the garbage can. Once you throw away everything, come back and take the clothing protector off of your partner and put it in the laundry hamper. Notice she always walks around behind the client to take off the clothing protector. Never pull it off from the front. Give your client their common care items. Remove your gloves. Wash your hands, and your task is complete.
Nice information to read. And anything more for you? Good. So I'm done. I wash my hands, and task complete.
And that's it. Good job, guys. All right, this skill is helping a client to brush their teeth. The first thing you want to do once you've washed your hands and got your gloves on is get your materials ready. Make sure you have everything you need for the skill before you start. You'll need a clothing protector. You want to help the client to put the clothing protector on once you start. You need toothpaste and a toothbrush. The toothbrush is going to be wrapped in plastic. So if you find a toothbrush that is not wrapped in plastic, do not use it. It has to be clean and sterile for this process. You want to get a little napkin, so if they get their mouth a little bit messy, you can wipe them off. Make sure that you use the napkin at least one time, even if they're nice and clean, because you're supposed to use it at least once for the test. You want to get a pink kidney bowl, and you're going to use this for when you have to rinse and spit, or the client will have to rinse and spit. Also, have a cup of water ready to go. Room temperature is fine. Cold water can hurt someone's teeth, so room temperature is best. When you've got all your materials ready, get the client ready for the skill. Make sure they're comfortable and sitting comfortably, and help them get the clothing protector on.
Are you okay? Okay. You sitting straight? You good?
Put the clothing protector on nicely, not too tight that you're choking them.
Sorry.
And have a seat. Now keep in mind, for demonstration purposes, the table is to the side of the two demonstrators, but in the test, you'll have a table between you and your partner. There will be a table in the middle of the two of you, and during skills class, you'll see this done correctly. Take the toothbrush out of the plastic and go ahead and get that ready. Take a little bit of water and dribble it over the end of the toothbrush so that you wet the toothbrush, and then get some toothpaste and put it on the toothbrush. You don't need to use too much, just a pea-sized amount will do the job just fine here. Now, this next part is very important, so pay close attention. This skill itself is brushing the client's teeth, but a lot of this is giving verbal cues to do things. Listen carefully as Litza does this skill, and listen to the verbal cues she gives her client, such as open your mouth, close your mouth, lift your tongue, move forward, tilt your head. You want to tell your client what you need them to do to effectively brush your teeth. The other thing you're going to do is before you start brushing your client's teeth, you want to ask them if they have any pain or sensitive areas in their mouth that you need to know about before you begin.
Are you okay? You had any problems in your mouth? All good? Okay, can you open your mouth for me, please? Now I'm going to start in the top. Okay, can you open a little bit more for me? Thank you.
Start on the top, brushing in gentle circular motions across the front surface of the teeth. When you've done that, next move and brush the bottom surfaces of the teeth, and then the back of the teeth. And always start on the top.
Can you open a little bit more, please? Thank you. That's good. You have very big mouth. Okay.
Complimenting your client's big mouth is not recommended.
Please?
Assist the client to rinse and spit.
Want a little more?
and wipe their mouth if they get a little messy before you begin the next part. Next, you're going to do the bottom teeth, the same way you did the top.
Can you open your mouth, please, for me?
It's not necessary to put more toothpaste on there. Simply continue the toothbrush the way it is. As you do this, make sure you're communicating with your client simple things like...
All okay? So you feel any pain or something? All good? Okay, perfect.
Make sure you set the toothbrush down on a napkin when you put it down, not on the table.
Continue. Okay, take it back. One more time. Okay.
Finally, once you've done brushing your client's teeth, offer to brush their tongue. Say something like, "Would you like me to brush your tongue?"
Would you like to brush your tongue?
And cue the client to stick out their tongue.
1,
Brush in a gentle downward motion,
2.
holding the toothbrush sideways.
Okay. Okay, this is the last one.
Give
Almost
them a
done.
final rinse and spit.
Perfect. Now all clean. Good girl. Oh my God.
And you're ready to wrap up the skill. What you do next is you're going to throw away the napkin and any other disposable items that you have. You're also going to take the toothpaste and put it back where you found it. Take the cup of water and pour it into the the pink kidney bowl. Take the cup of water and pour it into the kidney bowl and throw away the cup of water. Then you take the kidney bowl and the toothbrush to the kitchen sink. Once you're at the kitchen sink, you dump the kidney bowl out, rinse it, dry it, and set it on the counter next to the sink. You'll also take the toothbrush and rinse that at the kitchen sink and put it in the kidney bowl. Later, the proctor will throw away the toothbrush and clean, sterilize, and disinfect the kidney bowl for the next person's use. Come back into the room, help your client to remove their clothing protector, throw it in the hamper, and you're just about done. Make sure they have their common care items. Check to make sure that they're safe and comfortable and they feel good after having their teeth brushed.
How you feel? All good? Okay. There is your cell phone. This is something for you read. And anything more you need? Okay. So I remove my gloves. Wash my hands and task complete.
And always remember, when you're washing your hands, you simply have to say that you're washing your hands. You do not really need to wash your hands during the test. The only time you do is the first skill, and we will discuss that later in skill class. Everything done? Great job, guys. Let's move on to the next. All right, this skill is providing foot care to your client. This, let me just say, is a very complicated skill with a lot of steps. So I urge you to pay close attention as Litza demonstrates each step, because if I had to give a guess, this is the most commonly failed skill on the state test. Many people miss too many steps because there are so many. So take good notes, pay attention, and re-watch the video if you feel like you need to. All right, the first thing you want to do once you've established that your client is comfortable and they're feeling okay is put your gloves on. You've got your gloves on, you're ready to go. Let's go ahead and get our materials ready. First, you need to get a small washcloth. You'll use that for washing your client's feet. Next, you'll have a medium-sized hand towel. You'll use this for drying your client's foot. Next, you have a large bath towel, and you'll use this to put under the client's feet throughout the procedure to keep the carpet dry and to keep their feet clean and off the floor. Also, you want to have the orange stick and the nail file. You'll use these to clean and file your client's toenails. And you'll have the soap. Very important that you do not add soap to the water at any point. You'll be putting soap on the washcloth. I'll clarify this more later. And of course the lotion, which you'll offer the client at the end of the skill. Additionally, you're going to use one of the large white tubs. And the large white tub on the floor is what you'll use to fill with warm water and bring to the client. So, go ahead and get your white tub, fill it with warm water, and come back and have the client check it to make sure it's a good temperature.
Can you touch it? Is it okay for you? Perfect.
Once your client has verified the water is a good temperature, get the big bath towel, open it up, and put it down on the floor underneath your client's foot.
Can you put your feet up, please, for me? Thank you.
Open the bath towel completely so you make sure that all the area under their feet is covered. And you'll notice the client's shoe and sock is already off. This will also be the case on the test. The proctor will have them remove their own shoe and sock before the process begins, so that is not part of what you need to worry about for this particular skill. Once the towel's down, go ahead and bring all your materials down onto the towel as well. That way you can easily access them throughout the skill. Once you're organized and you have everything in easy access, the next thing you want to do is inspect your client's foot for any issues or rashes or sores or pain. Check between their toes and turn their foot over so you can see under it and check under their foot to make sure there's no sores or pressure sores. Finally, ask your client if they have any pain or sensitive areas.
Do you have any pain? All okay with your feet? Yes. Okay.
If your client has no problems with their feet, you're ready to begin. Get your big bin of water, move it over to where their foot is located, and gently place their foot in the water to soak. Make sure you put the bin long ways so that their foot can fit in the bin. Many clients don't have feet that are so small they can fit in sideways. You'll notice that there's enough water in the bin to completely cover their foot. Let the foot soak for 10 minutes. But just like with the nail care, you don't really do 10 minutes. You just say, it's been 10 minutes, and you can take their foot out at that point.
It's 10 minutes.
Now, help them take their foot out of the water and hold their foot over the water. The best place to put your hand is underneath their heel to support their foot, rather than holding their ankle. There we go. Now, while supporting their foot with one hand, take the washcloth and put it directly into the water, soak it completely, and leave it nice and wet. Don't wring it out. Now, take the soap and place the soap on the washcloth. Notice Litza holds the washcloth with one hand while she gets the soap with the other, and she puts a little bit of soap directly on the washcloth. She does not put any soap in the water. Wash the foot gently and carefully with the soapy washcloth, but remember, at no time will you put the soapy washcloth back in the water. Wash the top, the bottom, between the toes, everywhere on their foot just fine. If you're concerned, communicate with your client and ask them questions like, does that feel okay? Or, you're still comfortable, right? Or something like that.
This feel okay?
Yep.
And once you're all done washing their foot thoroughly, go ahead and take the washcloth and put it in the laundry hamper. You don't need it anymore. Next, put their foot back in the water and let it soak again. But now you want to rinse their foot. So use your hands to rinse their foot, rub the soap off into the water. Get between the toes, the tops, the bottoms. Just make sure you get all the soap off of their foot. Once you've done that, go ahead and take their foot back out of the water and pick up the medium-sized hand towel. Shake out the towel so it's ready, it's easy to use, and dry their foot now. Pat their foot dry, hold with one hand, pat with the other hand, and do a good, thorough job. Make sure you pat their foot completely dry. And of course, including between the toes. Once their foot is completely dry, you can throw the towel in the laundry. You don't need that anymore either. And you can take the water bin and move it out of the way. Put it aside on the floor somewhere else, just somewhere out of the way for now. You don't need it. Pick up the orange stick and make sure their foot is in a good position, and you can begin cleaning underneath each toenail using the sideways pointy or beveled edge. Just like with the fingernails, you're going to do a light scrape underneath the surface of the nail and then wipe it on the towel after each scrape. Check your client as you're doing this, asking them questions like, is that okay? Or, I'm not hurting you, am I?
Is that okay? I'm not hurting you, right? Good.
When you've cleaned all 5 of their nails, you can throw the orange stick in the garbage and go ahead and grab the nail file. With the toenails, you're only going to file the tip of the nail. You don't have to file the sides like you did with fingernails, so only file the very front of the nail. File in a gentle, brisk motion, going in one direction. It doesn't really matter what direction you go in as long as you can stay in the same direction consistently. File each toenail gently and carefully. And again, asking your client questions like, that's not bothering you, is it? Or that feels okay, right?
This feel okay, right?
Mm-hmm.
Once you've filed your client's toenails, go ahead and toss the nail file. You don't need that anymore either. And the final thing you'll check with is their lotion. Go ahead and grab the lotion and ask them, would you like me to put on some lotion?
Would you like some lotion?
Yes.
Client will say yes. And you put a little lotion onto your gloves. Rub it into your gloves to warm it up, and then you're going to put lotion on your client's feet. Keep in mind, lotion will never, ever, ever go on or between the toes. Stay away from the toes completely. This is to ensure that you don't accidentally put lotion between the toes. Also, make sure you don't lotion too high on their leg. You go too high, you might get slapped. Once you lotion their foot and everything's all set, you're ready to wrap up things. Go ahead and take your lotion and your soap and put it back wherever you found it originally. Usually it'll be on a table or a little nightstand. The rest of your items you've already disposed of or put in the hamper, so go ahead and take your white bin full of water to the kitchen sink. You'll take it to the kitchen sink, dump it out, rinse it, dry it, and then set it on the counter next to the sink. The proctor will clean and disinfect it for the next student's use. You'll come back into the room. When you're back in the room, your partner's shoe and sock will already be on. You're not required to put it back on them. So, for now, he's not wearing it, but don't worry. Your client will be wearing it when you're taking your test. Just like that. Magic. Look at that. So, take the towel and take it out from under their foot. They don't need to have that anymore. and place that in the laundry hamper as well. Check to make sure that your client has all their common care items.
Okay, there is your phone, everything. I remove my gloves, wash my hands, and that's complete.
And you're done. So that's foot care. Make sure that you paid good attention to that because, like I said, this is the most commonly failed skill. It's very easy to get mixed up on these steps or do them out of order or forget one of two of them altogether. So feel free to re-watch the video if you feel you need to, or if you have questions about anything that was done, talk to a member of the training staff and they'll help to explain one or more of the concepts to you. Great job, guys. Let's move on to the next. All right, here is what the sink should look like when you're doing the denture skill. Remember, you're doing the dentures at the kitchen sink, so make sure it's set up exactly like this. You've got a hand towel in the sink to prevent the dentures from falling and hitting the hard surface. You have the denture container to the left of the sink sitting on a paper towel, and you've got the toothpaste and toothbrush to the right of the sink, also sitting on a paper towel. Once you've got this all set up, this is all you need to do. You can begin the denture skill. We're going to zoom in briefly just so you can see a little bit better. There's the towel, and there is the toothpaste and toothbrush, and there is the denture container itself. All right, we're ready to start the denture skill. Let's have JoJo demonstrate. All right, so we are going to start denture care. First thing you want to do is make sure that all of your items are organized and ready to go. Yoandry's checking to make sure everything's there. Excellent. Turn the water on. Make sure it's cold water. Check the temperature. Yep, good cold water. All right, next grab your denture container, open it up, and take the dentures out of your denture container. Place them in your hand, using 2 fingers to hold them, while you use the remaining 3 fingers to make sure that you can pick up things and do other things. If you hold them tight, they shouldn't come loose. They shouldn't fall. Notice that he can shake his hand and there's no problems. Take the tray out of the denture container and rinse it thoroughly under the cold running water. Swab the denture container out, cleaning the inside and outside surfaces with your gloved finger. Rinse it one final time, and then once you've rinsed it, you can place it on the white napkin to the right of the sink where the toothpaste and toothbrush are located. It can sit there for now. Next, take the denture container itself, dump out any water if there's any there from the last person, and rinse it out real good. Clean it out, rinse it out with your gloved finger, scrubbing the inside and outside surfaces. Dump out the water, and then refill it with nice cold water. Fill it up nice and full. Don't leave it empty because you want to make sure the dentures are completely submerged in the water. There you go. Good. Okay. Oh, a little more. It never hurts to have too much. Now go ahead and put the denture tray back in the denture container and set it on the counter next to the sink. That's where the dentures are going to go once you're done brushing them. Finally, now take the dentures that have been in your hand the whole time, and we're going to brush those teeth. So grab a toothbrush and the toothpaste, wet the toothbrush, and then open the toothpaste and put a little bit of toothpaste on the denture toothbrush. You don't need much, just a little bit will do the job here. Give the dentures one nice little rinse to make sure that they're clean and you get any loose food or debris off of them. And you can begin brushing the teeth. For brushing the teeth, Yoandry is going to hold the dentures up a little higher than normal just to make sure that you can see what's done. However, when you brush their teeth, make sure you do it closer to the sink. You're going to brush the teeth in nice, even circular motions across the surfaces of the front teeth. Then brush the tips of the teeth, or the area where the teeth bite into food. And then you're going to brush the backs of the teeth. Once you've brushed all 3 surfaces of the dentures, Then you want to start brushing the pink areas, the gums, the roof of the mouth, the palate, all that area. You want to brush all the pink areas, leaving no part unbrushed. Once you've done a good, thorough job of brushing the entire denture, go ahead and rinse the denture under the cold running water to get it all nice and clean. Get all the toothpaste off. And when it's all nice and clean, put it back in the denture container gently and close the container. Next, take the toothbrush and you're going to rinse the toothbrush, clean it thoroughly, and you can set it down next to the sink. Meanwhile, you get the rest of your materials ready to go. Turn off the water, take the paper towels, and wipe the counter, both sides, making sure it's all nice and clean. And you can put the denture garbage, the towels and whatnot, in the garbage can. Finally, take the towel that you use to line the sink, squish it out, wring it out, try to get the water out as best as you can. If you have to set the denture, toothpaste, and toothbrush down while you do this, that's all right, but make sure you don't put the toothbrush down directly on the counter. Wring out the towel, and when you take your test, there'll be a clothing hamper next to you. For Jojo, there's one right next to him there, although you can't see it. Pick up your materials, do one final look at the sink and make sure it's clean, and then you're going to leave and go back to the client's room. Walk back to the room, put the denture container and the toothbrush and toothbrush back in the place next to the bed. Take off your gloves at that point, wash your hands, and the task is done. All right, this next skill is going to be turning and repositioning your client for comfort. Keep in mind you want to turn your client and reposition them every few hours if they are unable to do so themselves. If you have questions about how to do this beyond what this skill demonstrates today, please feel free to contact someone from the training department and we'll be happy to demonstrate other ways to turn or reposition your client if faced with different challenges than what we show you. Okay, the first thing is you want to just check on your client, make sure they're doing all right.
Doing okay? All good? Okay.
And let them know what you're about to do. No surprises.
Well, we're going to do one reposition to you today, so for you feel good, okay?
All right, first you want to ask to make sure it's okay if you remove the blankets from your client.
It's okay to remove the blankets? Okay.
Take the covers down. Once you have the covers down, next you'll cue your client to scoot towards you. The reason you want to do this is to make sure that when you turn them over to the center of the bed rather than turning them from the center of the bed to the edge of the bed, which would place them in danger.
Can you move a little close to me? That is okay. Thank you.
Next, you want to get your client's body in position so that you can turn them safely. Bring their arm up in the direction that you're turning them and put it next to their head. Take the other arm and cross it over their body or their chest. And take their leg and cross it over the leg in the direction you're about to turn them. Notice that the elbow, the hand, and the foot have all been turned and are facing in the direction you're about to turn your client, which is towards the camera. Next, place your hands on your client's shoulder and hip, and when your client is ready, turn them gently and carefully onto their side, holding onto them the whole time for stability and safety.
Are you ready? 1, 2, 3.
Make sure your client is stable and safe. And you can go get your first pillow. Place the first pillow behind the client's back. You want to smush the pillow down into the bed rather than pushing it against their back, and then tuck it under their body. This pillow provides support to the client on their back and ensures that when they lean back, they have a stable place for their body to rest on. Next, get a second pillow and place it between the client's legs. The important thing is that the knee and the ankle are both supported by the same pillow. So the knee and the ankle are both resting on that pillow. Additionally, you'll notice that Litza makes sure that the opening of the pillow is always facing away from the client's head. You never want the opening of the pillow facing up, always down. Finally, take the third pillow, come around to the other side of the bed, and help the client to put their arms around this pillow, much like a teddy bear. Make sure the pillow's not up so high that the client has it in their face or they can't breathe.
Okay.
And make sure that both arms are wrapped around it nice and safe. The reason for this pillow is to prevent the client from continuing the roll forward. When the arms are in front and they're braced on the pillow, it's a safety measure to make sure the client doesn't continue to roll and fall out of bed. When you've got the client all positioned and ready to go ahead and cover them back up so they're nice and warm. I think he's really asleep.
Yeah. Okay. Dun, 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 dun. He's sleeping. Yes.
Singing a lullaby is not required, but not a bad idea. Next, go ahead and get the client's common care items and make sure they're within reach of the client if they need them. Make sure there's nothing else that the client needs, and then you can wash your hands and wrap up the skill.
In this moment, I wash my hands, and that's complete.
And simple, but that does conclude turning and repositioning a client. If your client has any other challenges, as I said, that you have questions about, feel free to contact someone from the training department, and we'll be happy to go over it with you. Thank you, and see you soon. All right, now we're going to see the skill Peri-care demonstrated. Litza's going to go ahead and go through the skill with you to show you how to do it step by step. This is one of the more complicated, more difficult skills that you may have to do for the state test. And also, when you're really doing this with a client, it can also present its own unique set of challenges. If you have any questions about how to better perform Peri-care with your individual client, based on the challenges that they present, please see someone from the training staff, and we'll be happy to go over with different methods of doing Peri-care with a client if it's something that you need help with. All right, let's go ahead and begin. The first thing you want to do is make sure that you have all of your materials ready to go. You should be wearing gloves for the skill, of course. The skill involves water. And first, you want to have your moisture pad, your chucks pad, your under pad, your blue pad, whatever you like to call it. That'll keep the client's bed dry throughout the procedure. Next, have your 2 large bath towels. These 2 bath towels will go over the client's legs and keep them warm and give them some privacy during the skill. You want your 2 medium hand towels. One is for drying the front, and one is for drying the back. And then grab 4 small washcloths. The 4 little washcloths, 2 will be for wiping and rinsing the front, and 2 will be for wiping and rinsing the back. Grab the soap. We'll have some soap available for you. It may change from what's in the picture, but it'll be soap. And then you're going to get the 2 blue bins filled with warm water. Note how full the bins are. Litza will show you how full they are. Hold those down so they can see. They're not very full. There's only a little bit of water in the bottom, about a fingertip deep. The point being that you don't need a lot of water because you're not doing a bed bath. You're simply doing Peri-care. Okay, now let's go ahead and get started with the client. Obviously, you want to make sure that privacy has been provided before you start a skill like this, and have them check the temperature of the water. You can use the mannequin's hand to check the temperature, and you'll ask them something like, is that okay, or is that water temperature fine? You only have to have them check one of the water buckets, since the temperatures of the water buckets are the same. Next, ask if it's okay to remove the blankets from the client, and bring them down completely, since you need to expose the client completely to do the skill effectively. Next, get the blue pad, open it up, and put it down next to the client where you'll be putting it under them later. You can put it under their body a little bit by pushing into the bed, not into the client. Always push into the bed to get it under them. Then we're going to turn and reposition the client, much like the turn and reposition the client skill you saw before. Put the arm up above their head, the other one over their chest, and cross her legs in this fashion. Put your hand on their shoulder and their hip and let them know we're going to turn on 3. 1, 2, 3, or something like that. Keep your hand on her hip for support and stability, and use the other hand to push the pad under the client firmly but gently. Again, make sure you're not pushing against the client's skin. You're pushing into the bed. The bed is where you want to look for the give to get under the client. Roll her back once you've got the pad safely under her. You can uncross her legs, move her arms back in position, and grab the blue pad and unfurl it. Now we have the pad under the client and everything's ready to go, clean and safe for the skill. You can move the client's gown up at this time and get the bath towels. Once the client's bath towels are ready to go, put them over each leg, keeping their legs covered, but leaving the top of the thighs exposed because we're going to be doing that area for part of Peri-care as well. Now Litza's going to pull the gown up just a little bit to give you an idea of what it should look like for the test. You want to minimize exposure of the client throughout the procedure, meaning don't pull the gown up any farther than you absolutely have to do an effective job of Peri-care. For the purpose of the training video, Litza will pull the gown up much further than it should be in the test, just so you can see more clearly what she's doing. But remember, on the test, you want to leave the gown down as much as possible. Okay, let's get started. Go ahead and grab the soap and put it inside one of the bins. It doesn't matter which one. And you don't need much soap, just enough that you can take your glove and make some bubbles in the water. So take your glove and bubble up the water. Bubble, bubble, bubble. There you go. And you can dry the glove off the washcloth even that you're about to use. Soak the washcloth in the soapy water and wring it out really good. Make sure it's not dripping everywhere because you don't want to get the bed all wet. You soak the bed on this skill and they'll make you change the bed sheets. You don't want that to happen, trust me. All right, the washcloth's been soaked and wrung out. Now, we're going to wipe the client 5 times. Note that the washcloth, Litza, hold the washcloth so they can see the way it looks. It's been folded over, so it's all ready to go. So she's going to hold the washcloth in such a way that she can flip the tip of the washcloth each time she wipes. So wiping first in a downward motion toward the pad, she's going to flip the tip back, creating a clean surface to wipe the next time. So she wipes this a second time, flip the tip, clean surface, and wipes a third time. Hopefully you can see where she's wiping. She's wiping the side of the labia, the center of the labia, and the area where the leg meets the hip. So there's her 4th wipe. And then for the final wipe, you put the washcloth back the way it was when you first started, but start at the other end, the area that doesn't have a place to flip anything, and that's your 5th location that you can wipe as a clean surface. Again, wiping downward to the pad. When you're done, you can throw that in the laundry hamper and repeat the process, but this time with clean water. No soap this time. Soak it, wring it out real good, and wipe or rinse the client. Have your surfaces ready to flip the tips, and you got your 1 wipe. Flip the tip. 2. Flip. A 3. Flip. 4. And the final flip. Start back where you came from, but the other side, and do the final wipe right there. If you're having trouble with this, don't fret. If you need to grab another washcloth to finish wiping the client, grab as many as you need. You can use all the supplies you need to do the skill effectively. We're simply showing that it's possible to do it with 1 washcloth if you know how. Next, take the hand towel and you're going to dry the client thoroughly, patting them carefully and gently. Patting motion just like Litza's doing, patting from top to bottom the same way she wiped. Pat the genital regions, pat the upper thighs, between the thighs, and the perianal area. Excellent. Toss that in the hamper. Once your client's nice and dry, you can cover them back up. And now we're going to turn them over on their side. We're going to stop the video for just a second and give a brief break for Litza to get her materials set up, and we'll reshoot from the other side. Okay, now that Litza's in position, she's going to go ahead and put the mannequin in the turning position again, putting the arm up, the arm across the chest, and crossing the legs. Keep in mind that during the test, it will not be necessary for you to change position or move to the other side of the bed. You simply stay on one side and do the process the whole time on the same side. So Litza's turning the mannequin, placing her hands on the shoulder and the hip of the mannequin, and then she can push the hip forward and pull the shoulder back on this particular mannequin to keep it locked in place so the mannequin doesn't fall backwards. Next, you want to minimize exposure of the area throughout the procedure by again keeping her buttocks covered as much as possible throughout the skill. However, for the purpose of this, she is going to expose a little more than normal just so you can see better. Now, there's another consideration that you want to take into account. Litza will now point at a spot, the bed sore. There's a bed sore on this client, and you have to notice it. You have to say something about it. It may be a little tough to see in the video, but when you're here and you're practicing with the mannequin, you'll see it very clearly. So you simply have to say something like, "I see you have a little bit of redness," or "I think you might be getting a bed sore," or something like that, and let the client know that you're going to remove pressure from the area and check it again in a few hours. If your client actually does have a bed sore, you obviously want to make sure you report it correctly and get the appropriate action taken. They may need to see a doctor, they may need treatment, but for the purpose of this test, that's all that's required. Just mention you take pressure off the area and check it again in a few hours. Once you do that, the bed sore is no longer part of the skill and you can ignore it from here on out. Now let's go ahead and start the Peri-care process again. Go ahead and take one of the washcloths and you're going to soak it in the soapy water. Wring it out really good. And once it's wrung out, you're going to wipe the client 3 times this time, not 5, just 3. You're going to wipe in an upward motion, always wiping away from the client's genital area. So you're going to do 3 wipes. Each time after wiping, you're going to flip the tip of the washcloth just like before so there's a clean surface to wipe with. So you do a 1 and a 2 and a 3. Perfect. When you're done, toss that in the hamper and grab a new washcloth. This time, clean water, no soap. Soak it up, wring it out real good so there's no water on it. And repeat the rinse cycle. 1, flip, 2, flip, and 3. Good. Finally, go ahead and take the hand towel and pat the client dry, making sure that their entire area is dry and clean at the end of the procedure. As Litza's doing all this, she's demonstrating the mechanics of the skill, the ideas behind it. Later, in the live skills classes, I'm going to demonstrate more of the common care aspect of this, or your mannerisms and professionalism and friendliness and bedside manner, those sorts of things, because in a skill like this, those things are also very important to the test. So remember, this is just demonstrating the physical part of the skill, not the psychosocial. Okay, now her buttocks have been cleaned and ready to go. Go ahead and cover her back up and make sure that her little buttocks are not exposed anymore. And put the blue pad stuffed back under the client. You want to make sure you remove it at this point. So push the blue pad under the client. Once it's under her and she's all covered back up, roll her back onto her back and remove the pad out from under her. Take the pad and throw it away in the garbage. Get the client nice and comfortable. Put her arms and legs and everything right back into her correct position. You can remove the towels at this time if the towels are still on her, and toss those in the hamper as well. You'll notice that throughout this skill, we've done a lot of things, and we've done them while wearing the same pair of gloves. Keep in mind that when you work with a client, you will not wear the same pair of gloves as you engage in the client by cleaning them and then touching them and touching their things. You'll be changing your gloves a few times during a skill like this. However, for the purposes of showing the skill quickly and easily, we did not change our gloves. However, at this point, when you take the state test, they do want you to say, at this point, at least say that you would change your gloves. You vocalize something like, I changed my gloves, or I put on new gloves. That's all you have to do. You don't actually have to change your gloves at any point during this skill for the state test. So now Litza says, I changed my gloves, and she's got new gloves on.
I changed my gloves.
And she's going to cover the client. So leave the client nice and covered up at the end of the skill. Any items that you haven't gotten rid of yet, go ahead and get rid of at this time, such as putting the soap back where you got it, putting back any towels or anything that weren't automatically thrown away, or not thrown away, but put in the hamper. And now you're going to take the blue bins. With the blue bins, you're going to take those to the kitchen sink. You walk them out to the kitchen sink, you dump them out in the sink, rinse them thoroughly, dry them out, and then set them on the counter next to the sink. Then come back into the room, give your client their common care items, their phone and their book and their water. Remove your gloves for real at this point. Properly and correctly, don't contaminate. Tell the proctor that you wash your hands and you've completed the task.
I wash my hands and task complete.
Very good. Now, obviously, like I said, there's a lot more to the skill that involves the common care aspect of it, but all of that I'll be discussing in much more detail during class. So if you have any questions about the mechanics of Peri-care, feel free to ask someone from the training staff, and we'll be happy to go over in detail any other things that you have concerns about for this skill. Thank you, and we'll see you soon. All right, next we're going to show how to do catheter care with your client. Now keep in mind that catheter care is something that, for the most part, a lot of it is something you'd need nurse delegation to do. But the simple parts of catheter care, which is just the cleaning and maintenance of the catheter areas, those are things that you can do even without having nurse delegation. They're part of assisting your client with their activities of daily living. If you have any questions about any catheter issues with your client, or need to do something more complicated with the catheter and do require to have nurse delegation, please let someone from the training staff know, and we'll be happy to set you up with the nurse delegation material so you can add that medical enhancement to your home care aid or your CNA license. All right, let's begin. First, make sure that you check on your client, see they're doing okay, and have all your materials ready to go. Just say something like, okay, we're going to get started on your catheter care, or I'm here to help you with your catheter care now. So let's take a look at the materials. First, you need the one medium hand towel. The hand towel is going to be used for drying the catheter tube. You'll have 2 large bath towels. You'll use one to cover each of her legs throughout the procedure to keep her dry, comfortable, and give her some privacy. And then you have 2 small washcloths. The 2 small washcloths are going to be used for washing and rinsing the catheter tube. Finally, grab the soap. Any kind of soap will do as long as it's the good soap that we provide for you. So don't let the name confuse you. It's going to be any random soap. Finally, you're going to have 2 blue bins, and you're going to put some warm water in them. Make sure you put some warm water in the bins. One of those bins we'll add soap to. One of them we're going to leave soap-free with no soap in them. And they don't have to be too full, just full enough that there's water in them that you can soak the washcloth in. All right, let's get started. First, have your client check the temperature of the water to make sure it's a good temperature. There we go. That feels fine. Next, add some soap to the water, and you can bubble up the soap in the water to make sure it's nice and bubbly. Again, you don't need a lot, just a little bit of soap goes a long way. And bubble, 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 bubble. Good. Next, take the blankets off of your client, pull them down completely because you need to expose them completely to do this skill properly, and go ahead and cover up her legs with the towels to keep her comfortable and give her some privacy while you do the rest of the skill. I do recommend that you separate the mannequin's legs a little bit, pull them apart, just so that it's easier to do the catheter care skill. And since you're not turning the client, you can tuck the towel in a little bit if you'd like, just to make it a little more cozy. Remember, throughout this skill, you want to be saying things to your client like, "Are you doing okay? Are you warm enough? I'm not causing you pain or discomfort, am I?" Things like that. So pull the gown up, and you want to pull the gown up just high enough so that you can access what you need to clean, in this instance, just the yellow tube. Litza will show you the yellow tube that you're going to clean, this right here. This is all you're responsible for cleaning for this skill. You don't have to worry about cleaning the vagina. You don't have to turn them over and clean their buttocks. You don't have to clean the clear tube, only the yellow tube. So take the washcloth, first one, soak it in the soapy water, and wring it out really good so you're not dripping water everywhere. You'll note that there's been no blue pad or underpad used for this skill. That's because according to the test, it's not required for this skill. However, if you do it with a client and you do feel that a pad would be beneficial, feel free to use one. There's nothing saying you can't, but it's not required for the test. All right, hold the catheter tube right at the entrance of her vagina. Don't hold it away, hold it at the entrance and wipe 3 times. Once, wiping the top of the tube, then flip the tip of the washcloth so you have a clean surface. Wipe the bottom of the tube, flip the tip, clean surface. Make sure you're holding the tube at all times and wrap the washcloth around the tube and go down the length of it just like that. Excellent. Toss that in the laundry hamper, don't need it anymore, and get a new washcloth. This time, put it in the clean water with no soap, and repeat the process again. You're going to wipe the tube once, twice, and a third time, each time holding the tube as you do so, and flipping the tip to make sure you have a clean surface each time. 2, and 3. Very good. In the hamper. Next, take your hand towel, hold the tube again, and pat dry all the areas that you cleaned. You may have gotten some water on her legs throughout this procedure, so make sure you pat dry the legs too if you got them wet. The key here is not to leave any water on the client's skin or areas at the end of the skill. When you've done a good, thorough job drying them off, go ahead and toss that in the hamper. Don't need that anymore. And we can remove the towels and cover up the client again with her nightgown. Once the client is covered up, just like with Peri-care, we're going to stop and tell the proctor in the exam that we're changing our gloves before we cover her with her bed sheets. Just say something like, "I changed my gloves," or "I put on new gloves." You don't really change your gloves, you simply tell the proctor you do.
I changed my gloves.
So Litza's going to go ahead and cover up the client now with her bed sheets. Remember, there's a lot more to this skill as well. There's a lot of the common care aspect of it. Communication, talking with the client, explaining things. But in the narration, I'm showing you how to do the physical parts of the skill rather than the common care aspects of it. When you attend skills class, we're going to go over in more detail the common care aspect of how to do the skill. So take the blue bins to the kitchen sink. You're going to dump them out in the kitchen sink, rinse them well, dry them, and put them on the counter next to the sink. Then come back into the room, put away anything else that you haven't put away already, get the client's common care items and put them next to the client. Their phone, their book, and their water. Just make sure they're within reach of the client. When you're all done, you can remove your gloves for real this time. Tell the proctor that you're washing your hands, and wrap up the task. You're done.
I remove my gloves, wash my hands, and that's complete.
Task complete. Excellent work. Thank you for joining us. And if you have any other questions about catheter care or how to do it with your specific client with their specific needs, again, see someone from the Training Center and we'll be happy to help you with that. Thanks. See you next time. All right, everyone. So this skill is helping a client to walk. Now, for the purposes of this skill demonstration, there's no special considerations. There is no weak side. There is no gait belt. None of those things will be used in the test. However, if you have any questions about other methods of doing this particular skill, you can see someone from the training department and they can give you detailed descriptions on how to do it a different way if you need to learn it for a client. All right, let's get started. The first thing you want to do before helping a client to walk is make sure that they're wearing shoes or some other non-skid footwear. Help your client to put their shoes on. Be gentle. All right, excellent. The next thing you want to do is you want to begin giving your client some verbal cues or directions. So first, you want to let them know where you plan to help them walk to and make sure that's okay for the destination.
Okay, you're going to walk from here to here, okay?
Once your client agrees to the destination, the next thing you'll do is give them some instructions or cues on how best to stand up safely. First, cue them to slide forward a little bit in the chair.
Can you slide a little bit? A little bit, there. Okay, good.
Next, cue your client to reach for the armrests of the chair for support.
Can you reach it? Okay, perfect, perfect.
Your client might be a little shaky. That's okay. Next, place a hand on your client's back and with your other arm, put it in front of the client in case they need to hold your hand for support as they stand. When your client feels ready, ask them to stand up and let them know that you're there to support them if they need it.
Are you ready? Okay. We're going to count it 1, 2, 3. 1, 2, 3. Perfect. Okay?
We have success. All right, at this point, go ahead and walk your client safely while all the while communicating with them and making sure that they're all right, they aren't feeling dizzy or any other issues.
You okay? Do you feel dizzy? Okay. Slow. You're doing good. Perfect. Okay. Wait. Okay.
Once you've reached your destination, safely turn your client.
Great. Come on. Okay.
Let them know they're doing a great job. Walk your client back to the chair safely.
Wait there. Perfect.
So when you've arrived at the chair, cue your client to turn around.
Okay. There. You feel your chair.
Cue them to reach back from the armrests of the chair.
Reach back there. Okay, perfect.
And help them sit when they're ready.
Ready, right? Are you ready? Good.
What an ordeal. An excellent job. So, that was walking a client. Make sure they have their common care items. You wrap it up by washing your hands and moving on to the next skill. Thank you very much, and if you have any questions, see someone from the training staff and they'll be happy to help. All right, this skill is helping your client to get dressed, or dressing your client. The first thing you want to do is evaluate your client, make sure they're doing all right, see how they're feeling, good common care practices.
You doing okay? Mm-hmm. Okay.
The next thing you want to do is be mindful that their client has a weak arm for this skill. For the purposes of this demonstration, your client's right arm is weak. However, in the test, you don't have to worry about the right or the left. The proctor will let you know which arm is the weak arm. The client is not able to use this arm. They can't lift it or move it in any way, but the arm is not injured or broken or hurt. It's only weak. They just can't use it. Aside from that, you don't have to worry about any other special considerations on this skill. You simply have to make sure your client is dressed, neat and orderly at the end of the skill, and that throughout the skill you remember that their weak arm is part of the consideration. So let's begin. First, you want to give your client some choices on things that they may want to wear. So go to the client's location where their clothing is. For the test, there will be a dresser, and select a couple of clothing items and allow them to make a choice of what they'd like to wear for their shirt.
Okay. Had two beautiful to choose for you today. Which one you want to use? This one? Good choice.
Once your client has selected their shirt, you can put the other clothing items back and grab a couple of pants and bring them over and have your client make a selection of which pants they'd like to wear.
Well, I see you had two beautiful pants. Nice color. Which one you use? You want a gray one or gray one?
Gray.
This one. Perfect. Good choice.
Tough choice, but well made. Now that you have your client's clothing items, you can start by getting their shirt on first. You want to always dress them with their shirt first, and you always want to start with the weak side first. Check the shirt before you begin to make sure all the buttons are unbuttoned. And you can ready the sleeve, as you see Litza doing.
Can you try to sit down better? Please try. Little straight there. Perfect. Thank you. So I keep my hand.
You can hold the client's hand with your own and put the sleeve on them with much ease, doing it this method.
Put your hand over here. You can keep it there. So can
Use
you
the
go a
client
little
to lean
far for
forward.
me? A little bit. Thank you. Can you do this for me? Perfect.
And remember, your client can assist you with their strong arm, as you just saw. Once their shirt is on comfortably, make sure the buttons are all buttoned, the front buttons and the sleeve buttons. The only button you don't need to button is the very top button. Excellent. Nice and neat. Next, take your client's pants and assist them to put those on from the sitting position. You can cue your client to lift up their legs for you to make things easier.
1 second, please. Good, good, good.
Pull the pants up as high as they'll go while the client's sitting down, and then put their shoes on for them.
Can you help me here, please?
Remember, it's skills like this that are the reason I always tell people, when you come to the test, make sure you wear closed-toed shoes, but easy to slip on and off. Don't wear anything that's too complicated. Great. Once your client's shoes are on, next you want to assist them to stand by supporting their weak arm, hold their weak arm with your hands, and cue them with their strong arm to push up from the chair so that they can stand with stability.
When I count in 3, you go up. 1, 2, 3. Go up. Okay, good.
Very good. Your client can stand without too much trouble. So go ahead and take this time now to pull your client's shirt down as much as it can to get the wrinkles out, pull the pants up, tuck in the shirt, make everything nice and neat. Just special. He's a beautiful man.
Beautiful. Okay, I see you so beautiful.
While assisting your client's weak arm, once again, you'll help them to sit back down.
Okay, now you're ready. Put your hand there, please.
Cue them to reach
Come
for
on,
the chair.
slow. Okay,
Sit
you're doing
down.
good.
And you're pretty much done. Go ahead and make sure your client has their common care items within reach.
You have all your stuff there. And also, okay, your cell phone is not here. And everything is good for you. And your cell phone, okay?
And make sure the common care items are on the strong side, not on the weak side. That's a last-minute mistake that can cost you a lot of points. All right, that is complete. You'll simply say you wash your hands.
I wash my hands, and that's complete.
And task complete. Outstanding. Great job, guys. If you have any questions, feel free to ask one of our training staff. Remember, there's a number of different ways that your client might have challenges presented as you address them. So if you need additional instruction, we'll be happy to help you with that as well. All right, that's a wrap. All right, this skill is providing range of motion exercises to your client. For the purpose of this skill, we're going to demonstrate range of motion on one side of the body. However, on the test, you will also do one side of the body, but don't take that to mean you only have to do it with your regular client. Normally, if you have a client who requires range of motion, you will do it on both sides of their body, unless the care plan specifies otherwise. So hopefully that wasn't too confusing, but the point being is that on the test, and also for right now, we're going to show you just one side of their body. All right, let's begin. First, you want to just check on your client, make sure they're doing okay, and let them know what you're about to do.
Are you okay? All good? How you feel?
Okay.
Okay, good.
Explain to your client what you're going to do for the range of motion exercises so that you don't surprise them.
Well, we're going to do some exercise for you on motion. So first one, we're going to do this one, okay? The second one, we're going to do this one. And the third one, this one, okay? Got it?
Mm-hmm.
You sure?
Now that you've explained the first part of the range of motion, you can begin with the client.
Okay, so we're going to start. The first one, I hold it from here and here.
So you're going to support the elbow and the wrist.
Let me know until you resist, okay? All okay? That is okay? 1, 2,
Move your client's arm gently and carefully to the point of resistance.
and 3.
Don't
All
push so
good?
far. And make sure that you're constantly checking on your client to make sure
How
that
you
they're
feel
feeling okay.
in that one? Good? Okay. Then the next one is this one, okay? Okay. So when you feel some pain or something, let me know. Until you resist. That's okay? Can you go a little far? There. 1, 2,
Gentle, careful motions.
and 3. All good? Perfect. So the third one is this one.
Remember, the purpose of each of these exercises is to rotate and move the shoulder.
Over here in that position. All good? 1,
So again, you're holding the elbow and the wrist.
2, and 3. Perfect. How you feel? Okay, now we're going with your feet and your legs.
Once you've completed the arm range of motion exercises, check with your client to make sure it's okay you remove their blankets. Always ask that first. Don't ever just pull them off.
It's okay, I remove? Okay.
Once you've removed their sheets, you can begin doing their leg range of motion exercise. You don't necessarily have to demonstrate this one since it could prove a little difficult from your standing position, but at least explain to them what you're about to do.
Okay, so now we're going to do an exercise in your legs. Okay, you're going to put a little bit for me over here. We're going to do 3 times.
So you put your hand under their heel and under their knee, and you're going to use 3 range of motion exercise, 1, 2, 3.
1, 2, and 3. Perfect. How you feel? Good? Okay.
Next, you're going to help to stretch their foot a little bit. Stretch it back and stretch it forward.
Okay. 1, 2, 3. That's good.
And finally, you'll provide an ankle rotation exercise.
1, 2, and 3. How does that feel? Perfect. Okay. Now I put you in all your blankets on again.
Always make sure your client is covered up at the end of the skill.
You think it's over the table? Is anything I can do for you? Okay.
Make sure their common care items are within reach, which they are. You'll explain that you wash your hands at this point, and your task is complete.
I wash my hands, and that's complete.
And if your client has fallen asleep, don't worry. Just walk quietly out of the room and turn off the lights. That did not look like peaceful sleep. Thanks, guys. Now keep in mind, if you have any other questions about any range of motion exercises that you may have to perform with your client, or any special considerations such as with injuries or with weak arms or with imbalanced range of motion, such as one side of the body is stronger or weaker than the other, please feel free to talk to someone from our training center, and we'll be happy to go over specific details of how to work with people with different challenges. All right, thank you very much, and we'll see you next time. All right, this skill is going to be showing you how to put a pressure stocking or a support stocking or support hose or whatever you'd like to call them on your client. The objective of this skill is just to basically get a sock on a foot, so it sometimes gets overcomplicated, but we're going to try to simplify it as much as possible for training purposes. First, check on your client, make sure they're doing all right, see if there's anything they need. Let them know what you're going to do. Next, ask if you can remove the blankets from your client to get them ready. Take down the blankets, and then you'll pull up their pant leg on the leg you're about to put their stocking on. This is why on the day of the test, I always recommend that you wear pants that can be rolled up easily past your knee, so that if this skill winds up getting done on you, it doesn't create unnecessary hardship for your partner. Once their pant leg has been rolled up, go ahead and grab a pillow and prop it underneath their leg to elevate their leg slightly and make it so it's easier to put the stocking on while maintaining comfort for the client. See how she did there? Folded the pillow over and tucked it under. Next, go ahead and grab the stocking itself and start with the stocking inside out. Once you've got the stocking inside out and you found the heel, go ahead and slip your hand up inside the stocking and make sure that the heel is on the palm of your hand. Litza will show you. Now that you've got the heel of the stocking, finish pulling it on until you get to the toes, find the toes, and pinch the area of the stocking right by the heel, and watching how Litza does, remove the stocking. Notice that with that one easy motion, she's created a pouch. Hold the stocking down so they can see inside. You see inside there where her fingers are? That's where their foot is going to go. Now, you want to be able to find the seams of the heel so you know which way up and which way down for the stocking. The seams are located there and there. Now come around to the front of the bed and go ahead and start putting the stocking on the client. Your client or your partner will hopefully be able to assist you with this by keeping their foot nice and firm, keeping their legs straight, and pointing their toes slightly downward to make this easier to get the stocking on. Litza has lined up the heel to the heel and made sure that the lines are there, so you know you're not making a mistake before you do all the work of getting the stocking all the way up. Now she rolls the stocking up and moves it down the client's foot, using her fingers to hook around the client's heel and pull it over the heel. This is usually the most challenging part of the skill. Once you get past this, everything else gets easier. Once you've got it over the heel, pull the stocking up as one piece in one fluid motion, up, side to side, back and forth, whatever works best for you, whatever gets the stocking up. You'll see that Litza is having a little bit of difficulty, but not too much. There's always going to be a little bit of difficulty with this skill because it's supposed to be tight. Now, once the stocking is on the foot, you're going to do 4 check marks. You're going to look for 4 things. Do the toes have some wiggle room? Yes. Is the heel in about the correct place? Sometimes it'll be lower, sometimes higher because people's feet are different sizes, but it has to be in the general right area. Are there any wrinkles in the stocking? Nope. And then check the top and make sure the top is pulled up all the way with no folds or wrinkles at the top. So if it's all great, then you are good. Go ahead and put your client's pant leg back down and remove the pillow. Cover your client back up. And ensure that they have their common care items. Check if there's anything else they need. Wash your hands and wrap up the skill.
Okay, all your stuff is there, close to you. Is anything more do you need? Okay. In this moment, I wash my hands and task complete.
And task complete. Excellent work. Now keep in mind with your clients, most of the times you will be putting in pressure socks on both of their feet, not just one. However, we demonstrated one because for the purpose of the test, you will only have to do just one. If your client has any special considerations or issues that you feel like would present more of a challenge for this skill, please let someone from the training department know and we'll be happy to talk you through how to do alternative methods of putting stockings on. Thank you, and see you again soon. Okay, everyone, this skill is how to transfer your client from their bed to the wheelchair. This one involves a lot of steps, so I want you to pay very close attention to the technique that Litza will use to get her client sitting up and safely into the wheelchair. The first thing you do is check on your client, make sure they're doing okay, and let them know what you're about to do.
Are you okay? Yeah. All good? Okay. We're going to transfer the bed to the wheelchair. Okay? Are you ready? Mm-hmm. Okay.
The next thing you can do is go ahead and remove their blankets, always letting them know, say something like, "Can I remove your blankets?" or "Is it all right if I remove your sheets?" Next, bring their feet close to the edge of the bed, not hanging off the bed, but close enough so that when you turn them, their feet don't slide across the bed during the process. Next, you're going to cue your clients to place their arms or their hands on your shoulders.
My shoulders, please.
While you put a hand underneath their shoulder and the other hand goes underneath their leg just above their knee. Look carefully at where Litza is positioned. Finally, with one motion, You're going to raise your client up and pull their legs down so the weight of their legs drops and it raises their torso in one motion. Litza will demonstrate now.
Okay, when you're ready. 1, 2, 3.
Notice even someone small, like Litza, can lift up someone big, like Yoandry, when doing this kind of technique. The body mechanics is all the secret. Once your client's sitting up and they're comfortable and you make sure they're okay, go ahead and put their shoes on. It is very important that you apply their non-skid footwear or their shoes before you have them stand up.
You're okay, right?
Next, grab the gait belt, and Litza is going to demonstrate for you how to put the gait belt on in front of the camera first. So you see the teeth of the gait belt, those little jagged edges? The buckle in front of the teeth is where you're going to slide the gait belt up into, like so, and then put the gait belt back down through the outer buckle, noticing the teeth bite into the belt, like so. And now the gait belt is securely fastened. It will not open. Also, you can't tighten it from this way. If you want to tighten it, you have to physically push it through from the other side or pull it through. You can't just pull it like a regular belt. Like that. Okay, now Litza's going to go ahead and put the gait belt on Yoandry. When you put the gait belt on your partner, make sure that when you're done, it's tight enough that it's almost like a regular belt. There's no looseness. It's not hanging. You can't like fit a whole arm in there. You want to make sure it's tight enough that you're completely flat to their body, but not so tight that you can't get your hands in there to use it, to hold it, to support your client. So she feeds it through the buckle. Make sure it's snug. It's not twisted or turned around. And if you have any leftover gait belt, go ahead and tuck the tail into the back to make sure that the tail doesn't accidentally cause the client to trip or tangle in the wheelchair while you're moving it. Once you've got the client stable and ready to go ahead and get the wheelchair positioned close to where the client's located. Before you can do this, you'll have to swivel the legs of the wheelchair out of the way, if it has legs. Not all do, but this one does, to make sure that they don't accidentally trip over that while they're backing into the wheelchair. Position the wheelchair very close to the client, close enough that all they have to do is stand up, turn their body, reach for the backs of the wheelchair, and sit down. Next, lock the wheels of the wheelchair. This is critical. The biggest safety hazard of transfers is having the client accidentally miss the wheelchair during the sitting down and falling. So make sure those wheelchair wheels are locked for safety. Now, go ahead and brace your knee against your client's knee for stability. Cue your client to place their arms on your shoulders and grab the sides of the gait belt. And when your client is ready, cue them to scoot forward a little bit and stand up.
Okay. 1, 2, 3, up. 1, slow.
Have them reach back for the arms of the chair.
Put your arms in the chair.
And sit down when they're ready.
Slow. 1, 2, 3. Good.
Excellent. Safe and sound. Get their feet comfortably back in the footrests. And now you can remove the gait belt from the client.
Can you forward for me?
Keep in mind that if you're in the client's home and you're going to be transferring there multiple times throughout the day during your shift, it's not always necessary to remove the gait belt. But make sure you do remove it before you leave every day. never leave with a client still wearing their gait belt. And of course, when you take off the gait belt, make sure you're very careful in pulling it off of them. Don't pull it off. Remove it by having them lean forward and take it off from behind them for safety. Skin is very sensitive sometimes. The gait belt's off. You can go ahead and put that back wherever you got it from initially. Take the wheelchair locks off. Bring your client to somewhere comfortable where they'd like to spend their time, and you can wrap up the skill. Just make sure they have all their common care items and they have everything else they need. So you can go ahead and wash your hands and wrap up the task.
Okay, in this moment, I wash my hands and task complete.
And task complete. Great job, guys. Yoandry's learning how to use a wheelchair, and we will let him enjoy that. Have a great day. See you soon.